name is Caitlin Coyne. This is my video presentation for Dr. Levy's 602 class at Touro College.
Today we will be discussing the topic of autism. There is not much we know about autism before the 20th century. The first time the term autism was used was in 1911 by the Swiss psychiatrist Eugene Bleuler. Dr. Bleuler used this term in reference to a group of schizophrenic individuals who exhibited catatonic behaviors. Schizophrenia and autism remained linked until the mid-1960s. In the 1940s, the term was used to describe children with emotional or social problems. Through the 1960s through the 1970s, treatments focused on medications like LSD, electric shock, and behavioral change techniques. Through the 1980s and 1990s, there was a move towards behavior therapy and the use of highly controlled learning environments. From the 2000s to present day, the most common treatment methods have included behavioral therapy and language therapy. Other treatments are added as needed that we will discuss further in this presentation. Leo Kanner was known as the first self-identified child psychiatrist. He used the term autism to refer to a group of children who displayed withdrawn behaviors in the 1940s. His work formed the basis of the modern study of autism. What is autism? Autism is a word that is derived from the Greek word autos, meaning self. This term meant to describe conditions in which a person is removed from social interactions, hence an isolated self. Autism spectrum disorder is a range of complex neurodevelopment disorders characterized by social impairments, communication difficulties, and restricted, repetitive, and stereotyped patterns of behavior. Autism is one of the 5 developmental brain disorders currently recognized in the Diagnostic and Statistical Manual of Mental Disorders, 4th edition. These disorders also include Asperger's syndrome, pervasive developmental disorder not otherwise specified, Rett's disorder, and childhood disintegrative disorder. About 1 in 88 children are diagnosed with autism. This represents a 23% increase from the Center of Disease Control's previous estimate of 1 in 110 children from 2009. There is no established explanation for this increase in autism. However, many people correlate this increase with the advancements made in research over recent years. Autism is almost 5 times more common in boys than in girls, with it occurring in 1 in every 54 boys compared to 1 in every 252 girls. Autism occurs in all racial, ethnic, and socioeconomic groups. Prevalence figures vary widely due to possible differences in screening programs and the availability of records. Evidence suggests that autism's true prevalence in the United States may be considerably higher. Overall, autism affects over 2 million individuals in the United States and tens of millions worldwide. Autism is a complex and unpredictable disorder. Symptoms and severity vary on a case-by-case basis. Today, we are still not able to pinpoint a direct cause of autism. However, significant progress has been made over recent years. Research suggests that any one of several factors may be involved in its onset. Experts have concluded that autism has a strong genetic basis. They have observed that there are abnormalities in the brains of individuals with autism involving the areas used for emotion, perceptual integration, and filtering sensory information. For those individuals who appear to not present a genetic predisposition to autism, researchers suggest environmental factors, especially those occurring before and during birth, can further increase a child's risk of onset. They include maternal illness during pregnancy, certain difficulties during birth, particularly those involving periods of oxygen deprivation to the baby's brain, along with the age of the parents at the time of conception. Researchers conclude that these factors do not necessarily cause autism themselves, but combined with genetic risk factors, they can increase the odds. Over the years, speculated causes have consisted of environmental toxins, vaccines, gastrointestinal abnormalities, and vitamin deficiencies. Current research shows a link among behavioral characteristics, developmental trajectories, neurobiology, and genetics as they relate to autism. However, many questions still remain on the precise causes of autism, and researchers continue its search to find the answers to these questions. Autism is a lifelong disability that has no specific physical characteristics associated with the condition. Parents usually notice signs within the first 2 years of their child's life. Symptoms and severity vary in each individual's case. The main symptoms that children with autism tend to exhibit are failure to develop communication skills, tendency to isolate oneself, disinterest in social interactions, any decrease in skills that a child once demonstrated, and repetitive or ritualistic behaviors. Listed in this slide are some examples of additional early indicators of autism. Individuals with autism may also experience some sensitivity to sensory input, such as loud noises. Some may also experience serious problems with behavior, while others may have trouble developing their abilities to understand other perspectives and behaviors. There currently are no medical tests available to diagnose autism. Children are assessed with autism-specific behavioral evaluations to determine if further evaluation is needed by a specialist. As defined in the DSM 4th edition, individuals must exhibit at least 6 symptoms total to be classified as autistic, including at least 2 symptoms of qualitative impairment in social interaction, at least 1 symptom of qualitative impairment in communication, and at least 1 symptom of restricted and repetitive behavior. Each individual with autism is different. Early intervention has proven to be very effective. However, it is key that each autism intervention plan is specifically tailored to meet the specific needs of each individual. This includes creating highly structured environments along with intensive skill-oriented training sessions to help children develop social and language skills. There are also some medications available to treat specific autism-related symptoms, such as anxiety, obsessive-compulsive disorder, or depression. Individuals who exhibit severe behavioral problems may be prescribed antipsychotic medications as well. Children with autism have a variety of special education programs and services available to them, depending on the degree and severity of the disorder. Each child requires their own specifically constructed individualized education plan. This is the first and most important step in teaching children with autism. In order for autistic children to have the best possible outcomes, teachers must understand each child's specific needs and the severity of their condition. Many autistic children require intense structuring for their daily activities. Teachers can incorporate highly individualized classroom exercises to help autistic children with certain problem areas. It is important for special education programs to provide this for autistic children. Another significant advancement in the education of children with autism is the use of various assistive technological devices. In 1997, under the Reauthorization of the Individuals with Disabilities Education Act, IDEA, school districts became mandated to provide assistive technological devices to students who were eligible. Assistive technologies offer many options that cater to a variety of learning styles. Devices such as iPads and tablets can help autistic children to better their communication and developmental skills. These devices can also help autistic children to learn and understand basic concepts. Also essential in the education of autistic children is the communication and involvement. Parents want the best outcomes for their children. As educators, teachers should also want the best outcomes for their students. It is key for parents and teachers to have open lines of communications with each other. It is the responsibility of the teacher to understand how to deal with the varying scale of special needs autistic children present. Parents depend on these special education programs and services for the future well-being of their children. Autism Speaks is the nonprofit advocacy organization that leads in the sponsoring of autism research. This foundation also conducts awareness and outreach activities aimed towards families, government, and the public. The mission statement of this organization is to change the future for all those who struggle with autism spectrum disorders.